Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about biomarkers of inflammation, unveiling the body's response. What are biomarkers? They are biological molecules found in blood, other body fluids, or tissues that indicate the presence and severity of inflammation. Purpose: detection. Identify inflammation even when symptoms are subtle. Diagnosis: aid in diagnosing inflammatory conditions. Prognosis: predict disease progression or outcome. Monitoring: track disease activity and response to treatment. Research: understand disease mechanisms and develop new therapies. Why are they important? Well, inflammation is a key component of many diseases, from infections and autoimmune disorders to cardiovascular disease and cancer. Categories of inflammatory biomarkers. Inflammatory biomarkers can be broadly categorized based on their nature and function. Number one, acute phase proteins. They are proteins whose plasma concentrations increase or decrease in response to inflammation. They are synthesized primarily by the liver. Examples: C-reactive protein or CRP, erythrocyte sedimentation rate or ESR, cytokines and chemokines, signaling molecules that mediate and regulate immunity and inflammation, produced by various immune cells. Examples include interleukin-6, tumor necrosis factor, and interleukin-1 beta. Cellular markers: changes in immune cell populations or their activation status. Examples include white blood cell count, neutrophil to lymphocyte ratio. Enzymes and metabolites, products of cellular damage or altered metabolic pathways during inflammation. Examples: lactate dehydrogenase and certain lipid profiles. Genetic and epigenetic markers, variations in genes or epigenetic modifications associated with inflammatory responses. Key examples: C-reactive protein, CRP. As we said, it's an acute phase protein. It rapidly increases in response to acute inflammation. It's nonspecific but highly sensitive. Clinical use: monitoring infections, autoimmune diseases such as rheumatoid arthritis, and cardiovascular risk. Erythrocyte sedimentation rate, ESR. It's an indirect measure of inflammation, the rate at which red blood cells settle. Function: elevated in many inflammatory conditions, slower to react than CRP. Clinical use: monitoring chronic inflammatory diseases such as lupus and giant cell arteritis. White blood cell count: it's a cellular marker. Elevated white blood counts, leukocytosis, often indicates infection or inflammation. Clinical use: it's a general indicator of systemic inflammation or infection. Interleukin-6. It's a pro-inflammatory cytokine. It functions as a key mediator of acute phase response, stimulates CRP production. Clinical use: prognostic marker in sepsis, rheumatoid arthritis, and COVID-19 severity. Tumor necrosis factor alpha. It's a pro-inflammatory cytokine. It functions as a potent mediator of systemic inflammation involved in cell death and immune cell activation. Clinical use: target for biological therapies in autoimmune diseases such as Crohn's disease and psoriasis. Procalcitonin, PCT. It's a peptide precursor. It rises significantly in bacterial infections, less so in viral infections. Clinical use: for differentiating bacterial from viral infections, guiding antibiotic therapy. Clinical applications, diagnosis, helping to identify inflammatory conditions, e.g., inflammatory bowel disease. Prognosis, predicting disease severity or likelihood of complications, for example, in cardiovascular disease. Treatment monitoring, assessing the response to anti-inflammatory therapies. And risk stratification, identifying individuals at higher risk for inflammatory-driven diseases. Challenges, specificity. Many biomarkers are non-specific and can be elevated in various conditions. Dynamic nature. Levels can fluctuate rapidly, requiring careful interpretation. Reference ranges vary between populations and laboratories. Future directions, multi-omics approaches combining genomics. Genomics is the study of an organism's entire set of DNA or genome to understand its structure, function, evolution, and role in biology and disease. Proteomics. Proteomics is the large-scale study of proteins, particularly their structures, functions, and interactions within a living organism or system at a specific time. Metabolomics. Metabolomics is the comprehensive study of all metabolites, the small molecules involved in metabolic reactions with a biological system at a specific point in time. Personalized medicine, tailoring treatment based on individual biomarker responses. Novel biomarker discovery, identifying new, more specific and sensitive markers for precise diagnosis and targeted therapies. Point of care testing, developing rapid, accessible tests for quick assessment of inflammation. Well, thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to my channel. Thank you very much again for listening.